Hi, Dr. Chioma Kapamba here, obesity medicine specialist. I often get asked this question by my patients. Doctor, what diet should I follow? What is the best diet for me to lose weight? In actuality, there may not really be the best diet. The best diet is one that you can follow, one that you can continue to use in the long run. The best diet is not one that you can follow for 4 weeks and lose a ton of weight, and then after that, boom, it all comes back. So I actually recommend that my patients just make smaller, achievable, maintainable lifestyle changes rather than go on a diet. I don't like the word diet because it just sounds like you're doing something for a while. And in actuality, when we're treating obesity or overweight, we want to make changes that are going to persist. So those tiny little small changes, maybe changing your white bread to wheat bread, maybe taking off one bun from your burger. So little things like that. Those are actually more important than actually say all of a sudden they go home, they're going to be confused. So I would rather we work on one or two things first, do those one or two things well, make it part of your daily habit, then add something else. So that is generally my approach with dieting. It's more lifestyle changes. I want my patients to be successful. I want whatever changes they make while they're working with me to be changes that they will continue, hopefully teach their friends, their family members, and make not just themselves healthy, but the whole, family, friend, community around them. Because they'll see them making these changes and being happy, and not feeling like they're just eating grass, or that they're suffering. So a lot of times my patients still want a specific diet. The Mediterranean diet is actually a pretty good diet. It's validated diet that we recommend for patients who have hypertension, high cholesterol, even diabetes. We generally look at the Mediterranean diet as a healthy lifestyle diet. It helps. Many people love it. It's easy to follow. So you may want to start with that. Another diet that you can follow, well, I wouldn't really call it a diet, but intermittent fasting is actually pretty good. If you do it properly, it can help increase your metabolism. So it's a great combination, especially if you're using intermittent fasting with some of the medications like Ozempic, Wegovy, Mounjaro that are available. But you really could do anything. So my main thing is coming up with a plan for them, picking 1 to 2 things that we can do well and going with that. I generally recommend that they eat in a certain manner, and I usually recommend starting with your protein because we're looking to burn fat, not burn muscle. We want to maintain our muscle as we're losing weight. So I generally want my patients to be eating enough protein so they have enough energy and so that they can build their muscle, or they can at least maintain their muscle. After they're done with their protein, then I say eat your vegetables, your fruits, then leave your carbohydrates for last. The reason why I say that is because I don't necessarily want people to not eat any carbohydrate, but I do recommend that they eat low fat, I do recommend that they eat low fat and low carb. Not necessarily no carb, but low carb. But I don't necessarily tell them, oh, well, eat this much or that much. I just tell them to put it at the end of their dining experience so that by the time you get to your carbohydrates, you're already full. Now, you'll have a few bites, you'll enjoy it, and if you're on one of these medications, these GLP-1 medications, which we prescribe, you'll probably have just a couple of bites and you'll be done because you've already filled yourself up with the other foods, and by now your stomach is giving you the signal that it's full and you don't want more. So you basically just eliminated or limited your amount of carbohydrates, which if you ate too much of that would turn into fat and would be stored in your body or muscles or liver, and you've had some carbohydrates, which you hopefully enjoy, but that's about it. So that's generally how I approach lifestyle dietary changes. And as they progress with the program, I then encourage them to be mindful about what they're eating, to really think about what they're eating and what they're putting in their bodies. Because at this point, a few weeks to months into the program, they're doing well, they're losing weight. Now they're looking for ways to be more healthy or healthful. So then we start diving deep into, well, what foods would we prefer that you eat? What foods are more healthy? What can we eliminate that doesn't really bring anything into the mix? So this is the general framework that I recommend, and it really does take working together with each patient and going with their preferences and their lifestyle to kind of come up with this, rather than just a cookie cutter, oh, here, follow this diet, oh, here, do this. So that's my approach, guys. If you have any questions, go ahead and ask. Feel free to send us a message. Our contact information is below, and we would love to help you successfully lose weight for the long term.